Hi everyone, it's Dr. Sarah Wells from Hobart, Tasmania. I'm a clinical psychologist and I'm on the social media committee for the Australia-New Zealand Academy of Eating Disorders. I've come here today to explain that what I'm going to do over the coming days is to produce some videos that you can watch at your own leisure about avoidant restrictive food intake disorder. The reason we're doing this is to help you understand what ARFID is and to sort of give you a little bit of enticement to come to the intensive workshop we have. And that is being held across a few areas of the of both New Zealand and Australia. I'm just looking down here for the dates. So it's 10th of October in Hamilton, New Zealand. It will be held 12th of October, Gold Coast, Melbourne 16th of October, Perth 19th October, Sydney 22nd October. It's a 2-day workshop and it's titled Cognitive Behavioural Therapy for Avoidant Restrictive Food Intake Disorder. We have two presenters coming. The first is Dr. Jennifer Thomas. She's a clinical psychologist and co-director of the Eating Disorders Clinical and Research Program at the Massachusetts General Hospital, where she evaluates treatments for individuals of all ages with avoidant and restrictive food intake disorder and other eating disorders. She's an associate professor of psychology in the Department of Psychiatry at Harvard Medical School. Her scientific research focuses on enhancing eating disorder diagnostic criteria to better reflect clinical reality. Isn't that helpful? Because we often find that we do need that in our researchers to help support us in our clinical practice. Jenny's books, Almost Anorexic, Is My Loved One's Relationship with Food a Problem, and Cognitive Behavioural Therapy for Avoidant Restrictive Food Intake Disorder, Children, Adolescents and Adults, and her 75 peer-reviewed papers and articles and book chapters describe the many forms of disordered eatings that many of us clinicians see on the coalface. She is also the director for the annual meetings for the Academy of Eating Disorders and associate editor of the International Journal of Eating Disorders. So we're very grateful at ANZAED that she is coming along with her co-presenter to teach us all about ARFID. She has a wealth of knowledge, obviously. So the next presenter is Dr. Kendra Becker. She's a clinical psychologist and doctoral fellow at the Eating Disorder Clinical and Research Program at Massachusetts General Hospital and also at Harvard Medical School. She has expertise and extensive training in CBT and FBT. She has lectured on ARFID, CBT for ARFID or CBT-AR, the assessment and treatment of eating pathology, and neurobiology underlying eating disorders at the national and international level. She has published over 20 journal articles and 5 book chapters and has a focus on emotional eating and personality traits in relation to eating behaviours and neurological substrates of restrictive eating disorders. She is currently also exploring the neurological and neuroendocrine features of ARFID compared to anorexia nervosa and the brain and hormonal changes that may result from successful treatment with CBT-AR. We have a few sponsors for this. We have the Robina Private Hospital, the Centre of Excellence in Eating Disorders from Melbourne, the Perth Children's Hospital and the Red Leaf Practice. So we are very excited for them to come and to talk to us more, and I'm excited to talk to you a little bit about what I've learned about ARFID so far after attending the Child and Adolescent Academy of Psychiatry conference 2 years ago, where Rachel Bryant-Waugh from Great Ormond Hospital in London spoke about her work with ARFID. So we will join all this information together as we go. But bye for now, and next time I'll have a chat with you about diagnostic criteria. So good evening.